Hello, very good evening to you. This is the BBC News at 10. Boris Johnson has issued a fresh warning tonight that coronavirus will overwhelm the NHS unless everyone starts to practice social distancing, and that the UK was no more than 3 weeks behind Italy when it comes to the spread of the disease. He's urged everyone in the UK to follow official guidance to stay at home to save lives. It comes as the NHS struck an unprecedented deal with private hospitals across England to utilise nearly their entire hospital capacity to help in the fight against the coronavirus pandemic. The NHS says the deal will provide 8,000 additional hospital beds across England, nearly 1,200 more ventilators and 700 doctors. News of the deal came hours before health officials announced that a further 56 people have died in the UK after testing positive, bringing the total here to 233. With the latest, here's Dominic Hughes.
Tonight, a stark warning from the Prime Minister. The NHS is at real risk of being overwhelmed by the coronavirus. Boris Johnson warns we are just 2 or 3 weeks behind Italy and the virus is accelerating. But some good news too, in what looks like a really significant deal with private hospitals. 8,000 beds, 1,200 ventilators and thousands of staff will be made available at cost to the NHS.
This is fantastic news. It will really help me and my colleagues on the front line to feel supported and to have the capacity in the hospital to admit the sickest patients to give them the care we need. My only concern about this is PPE, visors, masks, gowns. We know that we've had some shortages in the NHS recently, and I would like to see some assurances that the new staff who are coming on board are going to be protected and that there's going to be PPE enough for all of us to use.
Medical staff are still extremely concerned over access to adequate protective clothing. The government says enough of the right kit is available. Meanwhile, on the first day of what is meant to be something close to lockdown and strict social distancing, in the centre of Newcastle, some people were still out and about. From the experts, though, a real sense that a moment of crisis is fast approaching.
If you follow the advice, you are saving somebody's life. This is the time in your lifetime whereby your action will save somebody's life. It's as simple and as stark as that.
A picture of those who are being admitted to critical care units after falling ill to the virus has begun to emerge. Data was collected on 196 patients in England, Wales and Northern Ireland. More than half of them were being looked after by hospitals in London. There's a significant difference between women and men. More than 2/3 were male, and 132 patients needed a ventilation machine to help them breathe. 16 patients sadly died. 17 were able to be discharged to regular hospital wards. The rest remained in intensive care. There is now real concern about the number of cases that are presenting in London, but also a small but significant cluster in Birmingham and the West Midlands. But the truth is, this virus is spreading throughout the country.
So the government then tonight stressing just how crucial it is to follow official advice to help reduce the spread of the disease. Philip Norton is in York for us. And how have people been responding there then?
Yes, Kate, just have a look here. This is York city centre, and at this time of night, on a Saturday night, it would normally be thriving with people out enjoying nights out. There'd be the sound of music from pubs in this area, but it's almost silent, and this is a scene being repeated now right across the country in towns and cities with bars and restaurants closed. In fact, the only people really we've seen around here in the city centre are takeaway delivery drivers who are helping businesses as they adapt to this shutdown. But there are serious concerns about the number of people who ignored the advice to stay at home and went for a day out today. We've had reports of seaside resorts around the country reporting almost bank holiday-like conditions, including Brighton, Bridlington and Skegness.
Let's return to our main news tonight, and the Prime Minister then urging everyone across the UK to follow that guidance to stay at home to save lives. Our political correspondent Nick Eardley is at Westminster for us, and he couldn't be more clear on this now.
It has been an extraordinary week, hasn't it, with some of the most extraordinary interventions in modern British political history, but the message from Number 10 tonight is still stark. The Prime Minister telling the country that the UK at the moment is just 2 or 3 weeks behind Italy, urging everyone to follow that advice, saying without a huge national effort to try and stop the spread of this virus, the NHS here could well be overwhelmed.
In Italy, nearly 800 people have died within the past 24 hours, bringing the total of deaths there to 4,825. A lockdown to limit the spread has been in place for weeks, but now tougher measures have been introduced in the worst-hit area, Lombardy, with a regional president announcing that from tomorrow all sport and physical activity outside, even alone, will be banned. Sima Katecha is in Rome for us tonight. Sima.
Yes, more alarming figures coming out of Italy, and as you say, further stringent measures will be enforced tomorrow in the worst affected areas. Now, the hospitals in the north are suffering the most, with some running out of ventilators and face masks, and the children here are also feeling the impact of this outbreak too.
No children, just empty playgrounds in Rome's largest park. Even tougher rules that have come into force today say people can't go into them to try and curb the outbreak. Here for several weeks, schools have already been closed.
The only noises that you can hear are the bells, the church bells, which is nice, but the other noise is the ambulances. That's all, the only two noises that you hear.
In Lombardy, the worst affected region, teachers say some children felt lost without social contact, but virtual lessons are helping.
To begin with, they were scared, I think, of their reality being taken away from them. Being able to actually deliver reality through a computer, even if he's obviously on a completely different scale, has been particularly important.
From tomorrow, people in Lombardy will no longer be allowed to exercise, even on their own in open spaces, as part of the measures aimed at slowing down the spread of the virus. All vending machines will also be banned.
The number of deaths from coronavirus in Spain has jumped to 1,326 in the country's biggest one-day rise so far. It overtook Iran as the world's third worst coronavirus-stricken country yesterday after China and Italy. The number of registered cases in the country has risen to nearly 25,000. The US athletics governing body has added to the growing number of calls for this summer's Olympics in Tokyo to be postponed because of the virus. The federation's chief executive said in a letter that holding the games in the current global situation would not be in the best interest of athletes. The husband of a British woman who died after testing positive for the coronavirus whilst on holiday in Bali has spoken for the first time of the devastation of his loss. Kimberly Finlayson, who was 52, had underlying health conditions and had undergone 2 emergency operations in an Indonesian government hospital. Mr. Finlayson said perhaps the outcome for his wife might have been different if she'd been treated in the UK. Our correspondent Jeremy Cook reports.
Myself and my 4 children are absolutely devastated to lose the most beautiful wife and mother. She's so generous, she's so full of life, she's so powerful, courageous, supportive of all of us. I lost half of myself.
In the holiday hotel room in Bali, he should be sharing with his wife. Ken Finlayson is alone, grieving.
She actually booked this hotel, but she never managed to get here.
52-year-old Kimberly fell ill soon after arriving from the UK. She had diabetes, but had been in good health.
This phrase, underlying health issues, has come into our language over the really difficult past 10 days or so.
The irony of that phrase to me is that I don't know many people in their 50s that haven't received medication, haven't had some health issues.
Ken is warning other British travellers healthcare in less developed countries is not the same as back home. He watched Kimberly die in a government hospital during surgery.
She said that she loved me. And, we exchanged that for a few minutes and, looked into one another's eyes. So we had that time to do that, and I'm at peace in that sense, and hopefully Kimberly is.